At that stage, there was also mild synovial effusion within the joint. If on repeated examination, you note that there is development of joint capsule distension, we then have to consider what is the reason for the synovial effusion. Is there infection? Is there an intra-articular fracture or a delaminating injury of the articular cartilage? In the picture on the right, we can see cartilage lifted off in a flap-like way within the metacarpophalangeal joint. Look at the appearance of the synovial fluid. Is it suggestive of joint contamination or sepsis? Or is there blood, the result of hemarthrosis? So if you cannot determine the source of pain in the first several hours, repeat the examination the following day, working from basic principles, starting the entire examination all over again. But do try not to miss synovial sepsis on day one, because this could have long-term deleterious consequences for the outcome of the horse. It is possible to have acute onset lameness and the subsequent development of visible periarticular cellulitis. So, for example, a horse can become non-weight-bearing lame on a hind limb with no palpable abnormality, no visible abnormality, and over the next several hours, you may see the development of focal or more diffuse swelling around the tarsus. This may be exquisitely sensitive to palpation. Periarticular cellulitis becomes much more challenging to manage the longer its duration. In the horse on the right, we can see peritarsal cellulitis of several days duration. The swelling also extends into the metatarsal region. The day after this photograph was acquired, the back of the tarsus opened up like a watermelon, and there was complete skin loss, and the horse took a very long time to make ultimately a complete recovery from a functional point of view, although was left with a very nasty looking limb. You need to try to maintain the confidence of the client if you cannot make a diagnosis, but also you need to warn them that the majority of injuries are not going to become catastrophically worse, assuming that the horse is confined to box rest. But we may need to provide analgesia. So, I say again, repeat the examination in a methodical way. Determine whether or not there is any joint capsule distension or any distension of a tendon sheath. Is there any pain on passive manipulation of a joint? Is there the development of any other soft tissue swelling? And if the answer is yes, don't delay performing either radiographic or ultrasonographic evaluation if the clinical signs become more localized. Bearing in mind, however, that with very acute injuries, the results may be negative, and we may need to repeat the examination several days later. So with an acute non-displaced fissure fracture, a fracture may not be evident radiographically on day one, and it may take 7 to 10 days before the fracture becomes apparent. The fracture that we can see on the right, an apparently incomplete fracture of the lateral condyle of the third metacarpal bone, is of 2 days duration. Bear in mind also that over the following 24 hours, the horse's stance, demeanour and level of discomfort may actually improve